Hey, this is something I did not know. More women than men suffer from sexual dysfunction. It's a topic we don't often talk about, but we shouldn't be embarrassed. Joining us now to discuss the symptoms and treatments for sexual dysfunction among women is Dr. Leah Millheiser. She is OBGYN at Stanford Medical Center. Thank you so much for coming back, Dr. Leah.
Thank you for having me.
Now, why is this topic so taboo?
It's so taboo. Well, to answer that question, you really need to look at our culture. American culture is made of this rich blend of society, or of religions and cultures, and there's so many different perspectives on sexuality. And so what has happened historically is that people have adopted this don't ask, don't tell policy when it comes to female sexual topics, female sexual dysfunction, what have you. Well, if you look back 10 years ago, women who had a sexual problem really associated that with being a psychological problem. And so they were afraid to talk about it because they might think there's a stigma associated with it. So people really kept it to themselves. So we really credit Viagra with changing the way people approach human sexuality and human sexual dysfunction for both men and women. It really opened up the topic to a public forum. So now it's really shifted away from sexuality being a taboo topic. We're much more open about it now.
Okay, we're going to be really open today. So let's talk about some of the symptoms for women when it comes to sexual dysfunction. What are they?
So when we talk about sexual dysfunction, it's very important just to make sure women know that just a complaint on its own is not sexual dysfunction. A persistent complaint that's there the majority of the time associated with personal distress. So it's got to be bothersome to the woman. That's when it becomes sexual dysfunction. So a woman can come into my office and say, you know what, doctor, I've lost my sex drive and I just don't care. That on its own is not sexual dysfunction. So there's 4 classifications. There's sexual desire disorders, there's sexual arousal disorders, which can be arousal in the brain or arousal in the genital region. There's orgasmic disorders and there's pain disorders. So those are the 4.
So I mean, like, you have pain during sex, you can't have an orgasm, or what, vaginal dryness or something? Or what
vaginal dryness can cause pain. One of a very common disorder that not a lot of women know about, they don't know that this is abnormal, but it's so common, is something called vaginismus. And that's when women experience an involuntary contraction of the pelvic floor muscles. And it prevents them from having intercourse. They can't have intercourse. So it's very troublesome to a woman, and a woman learns to live with it and finds ways to work around it. But what we want women to know is that there is help out there and they should seek it out with their doctor.
What do you mean they can't have intercourse? Because it's too painful if they're going through that?
Exactly. It's too painful, and it's almost like the muscles form a wall and nothing can pass through that wall, so it makes intercourse very difficult.
Are there drugs for this, treatments?
Unfortunately, the FDA has not approved any treatments for women for sexual dysfunction. And interestingly, 43% of women in this country suffer from sexual dysfunction versus 31% of men. But you know, we're sitting around having dinner at night and Viagra commercials come on, and it's everywhere. And so it's interesting that nothing is approved for women yet. So we do have treatments, but they're used off-label, meaning the FDA has not approved them yet.
Okay, give us some examples. Let's say the ones you were saying the muscle tightens so much you can't have sex. What's a treatment option for that?
So that is actually a non-medical treatment. That's actually a treatment where a woman will work with dilators and work with what's called a pelvic floor physical therapist. These are actual physical therapists who work primarily on the pelvic floor. They don't just work on sexual disorders. They also work on disorders like interstitial cystitis, just endometriosis, general pain disorders that affect the pelvis. So what we try to do is teach women to relax these muscles, to take control back of these muscles so that they can prevent that involuntary spasm.
That's good. Okay, what about like dryness?
So dryness, so interestingly, Viagra, which has been approved for men, is used off-label in women. So for the same reason, it's for arousal. So what causes treatment for erectile dysfunction in men is increased blood flow. So the same thing is used in women. So that's what it does to women. It increases blood flow, it increases lubrication. So that is one off-label treatment.
Wait, so I could go to you, like my OBGYN, and say, can I get Viagra?
Viagra is, you could, but Viagra is one of those medications that you want to use it under the guidance of a physician. It's a very serious medication. It can be fatal if used by the wrong person. Let's say somebody has a heart condition. Let's say they're using something called nitrates, which is another medication, which can put them at risk. So yeah, if you work with your doctor and you've tried a lot of over-the-counter options, let's say you're postmenopausal, you've tried estrogen, nothing has worked. That is one one option that you can use, and it can also potentially enhance orgasmic potential in women.
Okay,
but again,
well,
under the guidance of your doctor.
Definitely seek your doctor. What about lubricants for dryness? Are those safe and effective?
Lubricants are wonderful options for women. In fact, I tell every single one of my patients, use a lubricant, because it is wonderful for women who have a little bit of dryness, or even women who don't have any dryness. It just makes it easier. So one thing I would caution women about with lubricants is that lubricants, one of the most common ingredients is glycerin.
Yes.
And glycerin can actually promote vaginal inflammation. Okay. Vaginal inflammation can lead to yeast infections. This is something that women experience commonly. If you're more prone to yeast infections, avoid the glycerin-containing lubricants. And you can find glycerin-free alternatives. Most of the companies make them.
So if we have any problems with sexual dysfunction, we should just go to our OB/GYN and just bring it up. That's the person we should ask? Any
physician. You can go to your primary care doctor, your internal medicine, OB/GYN, urologist, whoever you're seeing. And if they don't want to treat you, or if they don't know how, or if they just don't do that in their practice, they can certainly refer you to somebody who does.
Okay. Why don't OB/GYNs ask women in general, do you have any problems with sexual dysfunction? We're running out of time, but I guess you just bring it up with your doctor. Feel comfortable with it. Okay.
That's right.
Dr. Leah Millheiser from Stanford, thank you so much.
Thank you.
And we'll see you tomorrow.
Tomorrow on The View from the Bay, Helio, Maxim, and Jonathan. You've seen them spin on the dance floor. Now see the secret moves they share with Janelle. The men of Dancing with the Stars. The View from the Bay tomorrow.